My name is Cary Gentry, and I'm a colorectal surgeon in a single specialty colorectal practice here in Richmond, Virginia. We treated over 140 patients with colon cancer last year. And of those 140 patients, approximately 38% had stage 2 colon cancer. That was a lot higher than we expected and is compared to the literature of approximately 27%. We looked at our practice at the stage 2 colon cancers critically because we wanted to find out what was happening with these patients. What we found out was surprising. We had no consistent referral pattern for adjuvant treatment. As a matter of fact, a majority of the patients were not referred, which is consistent with the literature. The problem was that we were seeing several patients return with a recurrence who had normal pathologic features that we didn't expect to see. So we wanted to look at that information and determine if there was a trend or a reason for it. We added biology, and we think biology matters in the 21st century. And when we look at our practice in terms of treatment for these patients, we feel that the surgeon is no longer just a technician, but rather a part of the multidisciplinary team that can add that information about the biology. What we decided to do is begin a reflex testing policy where all patients who came in with stage 2 colon cancer and were treated surgically would then go on to Oncotype testing. The question for our practice was, of the T3 patients, what percentage of those T3s acted like T4s, meaning which ones were at high risk? And that's something that we had a difficult time differentiating with the traditional pathologic features. So with the addition of the Oncotype DX scoring, we can at least stratify their risk and have the conversation with them about what their chances of having recurrence were. That information is knowledge, and that knowledge for the patient is very vital. We ask these patients what they want to do, and with this information, it helps us to determine their risk and give them a more informed conversation about their stage. So as an 8-member surgical group, we think biology matters, and that going forward in the 21st century, that a multidisciplinary approach to cancer treatment starts with a conversation between the surgeon and the patient. The Oncotype DX test has afforded us the opportunity to have that conversation with that patient about their risks of recurrence.